Welcome to Mastering Your Financial Life, hosted by Judy Heft, the founder and CEO of Judith Heft and Associates, Financial and Lifestyle Concierge. This year, she's celebrating 27 years in business. In every episode, Judy interviews professionals who help others successfully manage their financial lives. You can find this show on YouTube, LinkedIn, Apple Podcasts, Spotify, Google Podcasts, Stitcher, and more. Judy is the author of 2 books, How to Be Smart, Successful, and Organized with Your Money for a Better Today and Tomorrow, and her latest book, Mastering Your Financial Life Cycles, How to Successfully Manage Money in Every Decade of Life. You can read chapters of her books and catch prior episodes of the show at www.judithheft.com. Now, here's the host of Mastering Your Financial Life, Judy Heft.
Hello, everybody, and welcome. Welcome to episode 57 of Mastering Your Financial Life. I'm Judy Heft, founder of Judith Heft and Associates, celebrating 27 years in business this year, working with high net worth individuals and small businesses to help them with bookkeeping and bill pay. And today I'm really excited to be here with Maura Carley because she's going to demystify the whole insurance situation for us, I'm sure. So she's the founder and president of Healthcare Navigation. They're a national healthcare advocacy firm. They assist clients with health insurance and Medicare submissions and everything else that has to go along with that complicated world. She's also the author of Healthcare Insurance Navigating Traps and Gaps, and there's some helpful information in that. So, I'm really excited to be here with you, Maura. Welcome. Thank you.
Well, thank you. Demystifying healthcare is a very, very tall order, but I will do my best. It's such a confusing area.
I know if anybody can do it, you can do it. So I'm excited to be here with you. So, since we're, it's September, I don't know if our people will be listening to it in September, but anyway, I think it's really a good time to talk about the open enrollment that's coming up next month. So can you it's so confusing for people, you have to wait till October. I think it's the 15th and you've only got 6 weeks. And why is that? And how does it all work?
Yes, well, I think you're talking about Medicare Open Enrollment.
Oh, yes.
And we can also talk about the individual market open enrollment, which starts shortly thereafter. And of course,
you can see how confused I am already.
Well, you know what? It is confusing. There's so many enrollment periods. But why don't we start by saying, if you work for a company, you're likely, if you have coverage through them, to be going through their open enrollment process in the fall, but not necessarily. A group can have a renewal at any time. But what, Judy, you're talking about is Medicare's open enrollment, which starts October 15th and ends December 7th for a January 1 effective date. And that is confusing to people who are going on to Medicare. Often they're thinking, oh, I've got to do something. Well, no. This enrollment period is only for people already on Medicare A and B. And so what they can do during that time period is, if they're on an Advantage plan, they can return to original Medicare. If they're on an Advantage plan, they could select a different Advantage plan. If they're on a Part D plan, they can change Part D plans. Normally, if you're on original Medicare, everybody has to have A and B. That's original Medicare. And then if you stay in original Medicare, you tend to have a constellation of a private supplement and a drug plan. But the open enrollment period has nothing to do with your private supplements. And so many people don't really need to do anything. If you feel like you made a good choice, and you really should look at it when you're going on to Medicare as, I want to make a choice that's going to last me, if not forever, for many years. Things can happen, of course, but If you're the big decision of staying in original Medicare or going on to Medicare Advantage, which is opting out of original Medicare. That means the government takes the money generally, often a little more than they think they're going to spend on original Medicare, and gives that to the plan, the Aetna, the United, whatever Advantage plan you sign up for. If you're on an HMO Advantage plan, honestly, that's one group of people. Not always, because you have people like my mother, who was a Kaiser Permanente member for decades, and she just aged onto her Advantage plan with all her same doctors. And there are people, they don't think they're ever going to move. They're very happy with their network. They're more appropriate for an HMO, but you have to understand an HMO always has a network, so you don't have the access to all the doctors and hospitals that you do if you stay in original Medicare or have an Advantage plan that has an out-of-network benefit.
So that's all for Medicare.
That's all for Medicare, but I just want to say, as awful as it is that everything is jammed into such a tight time frame, it's better than it used to be. Before 2006, we didn't have Part D. Can you imagine?
Wow.
No outpatient drug coverage through the government, through Medicare for years and years and years. And when it finally started in 2006, the open enrollment period went through 12/31. And that was a mixed blessing too, because, people agonize sometimes about these things. They postpone their decisions. And then they wait until the bitter end, then they don't have their cards. So honestly, I'd be happier if it started a little earlier, but I'm much happier with the December 7th end date than what was once the December 31st.
So Maura, can you explain to our listeners and me, what is the difference, what is the advantage of doing a Medicare Advantage plan or just the regular Medicare plan?
Well, you know what? Original Medicare provides the greatest freedom of choice with the least hassle. If you're one of those people who knows, well, if I'm diagnosed with something very serious, I want to be able to go wherever I want to go, then you're the kind of person who should stay in original Medicare. Advantage plans can offer benefits beyond what original Medicare does. So that's technically Medicare Part C, but you'll see that you can buy plans that offer some dental cleanings or maybe credit toward a hearing aid or a gym discount. And they're getting, they're even more elaborate offerings if you have an Advantage plan through your former employer. They sometimes have really sweetened the benefits. But what bothers me about so many Advantage plans is people don't understand that they have rules and a network. And, people on original Medicare don't have to deal with prior authorization the same way that people in an Advantage plan do. Or, we had a client last year who went on an HMO product. I think she was too sick to be on one. She needed a heart transplant.
Oh, wow.
And the transplant surgeon and Cedars-Sinai in LA were not in the network. So she had no coverage where she and her family and her doctors wanted her to have that transplant. So you have to weigh these things very carefully. Unfortunately, many people are susceptible to the ads that are relentless. television, radio, in your mail. And they never tell you that the Advantage plans have a much higher out-of-pocket exposure. You might have a zero premium plan. Those kinds of plans tend to have co-pays for everything, co-pays and co-insurance. But you can have Advantage plans with $6,000, $7,000, $8,000, as your out-of-pocket maximum. And what I always worry about is that people are signing up based on the sales pitch rather than an understanding, a thorough understanding of what they're getting into.
That's what I've understood too from people I know that have been pushed into Advantage plans. It's from the salesperson that really encourages them to do that. And I'm wondering, and maybe I'm wrong on this, are they getting a more of a discount on that? Is it, or a commission, the salesperson? Is that why they push that Advantage plan?
They are very lucrative to sell.
I thought so.
Think of what a percentage is of what Medicare plans to spend on somebody during the month, the average Medicare beneficiary. I mean, I get emails. I got one just a couple of weeks ago because we're not brokers, we're fee-based consultants, but we still get these emails. Make $150,000 every year for the rest of your life by selling Advantage plans. And honestly, I'm very I don't know. I think the healthcare dollar should be, because those commissions really are part of the healthcare dollar, and I think there should be a better way. But the burden is on the consumer. The burden is on the consumer.
I have seen people get pushed into that plan. I don't know if it was necessarily the right plan for them, but I don't know that much about it anyway. But I was curious about that.
Yeah, well, let me just add one point that's so critical. There is a 6-month guaranteed issue period after your Part B effective date where you can get any supplement in any state, guaranteed issue regardless of your health. After that, in most states, although, you can apply if you change from Advantage to original Medicare, but you might not be able to get a supplement because you can be subjected to medical underwriting and rejected. Now, that's not true in Connecticut and New York and Massachusetts, but in most states, it is true. So you have to be careful when you elect that Advantage plan and stay with it. Like this client I talked to you about who was in heart failure, we knew she couldn't qualify for a supplement again in California with her health history. She had just missed the 6 months, but at least we got her on a PPO, an Advantage plan PPO, that did allow her access to Cedars-Sinai.
Oh, that's good. Because you were talking about, I was going to ask you, did you have to pay for all of that out of pocket? Because it can wipe you out.
Nobody can do that. Unfortunately, it's a very tragic story. She died before her coverage, her new coverage was effective March 1 before it even, she came to us the first week in February. We arranged for new coverage. I think she was postponing care. It was horrible. It was horrible. So she never should have been sold an Advantage plan with her history of heart failure. Wow. At least not an HMO, in my opinion.
And so what about individual market enrollment? What about that stuff for regular people with their own insurance? How does that work?
Well,
there's really change when you want to, right? You have to only do it at certain times. Is that correct?
That's right. That's right. And here, all these years later, because this started for the season beginning with coverage effective January 1, 2014, all these years later, people still don't understand this. I mean, we still get calls, I want new coverage, or my son is on Medicaid and I don't want him on that. Well, you know what, there's nothing to be done unless you have a qualifying event outside this annual open enrollment period. And it begins November 1 and it ends December 15th for a January 1 effective date, but it's longer than that. But most people want a January 1 effective date. And that is too short. That is a very, very stressful 6 weeks because it isn't as stable a market still. I mean, it's become more stable, but I was on the board of Access LCT, the Connecticut exchange, for almost 4 years, and we had 5 insurance companies that were in the marketplace, and we've been down to primarily Anthem and Connecticut for a while, but they still offer so many products and on and off exchange. You don't have to buy it through the exchange. If you want a premium subsidy, you have to. But given that the information isn't available until close to November 1 or November 1, it's a challenge. It's a challenge for people. I think in Connecticut, Access LCT does a very good job. It's just structurally too short a period.
Yeah, it's hard. This is, I'm still a little confused, or you explained a lot too. I think it just really, you really need to sit down and concentrate when it's yourself, when you're ready to do something, and speak to a professional like you, because you can really help figure it all out. Do I do the Advantage? Do I do the regular? Can I change if I'm not in Medicare? Can I switch? When can I do it? There's so many questions to be answered. And I think that, you're a great resource. So let's take a little break here. I want to come back. I want to see if we can talk about COBRA too, because that's another confusing topic to most people. And we deal with a lot of that because we have quite a few clients that are going through divorce, and then they need to get new coverage, and then how long can they be on their ex-spouse's coverage? How does that all work? So, and I know some people that don't do the legal divorce thing. They just get legally separated so they can stay on that plan because their spouse had a great plan. So it's a lot to talk about. So let's take a quick break here, and then we'll come back for more with Maura Carley.
Hey there. I just want to tell you a little bit about my new book that just came out called Mastering Your Financial Life Cycles. And here it is. It's how to successfully manage your money in every decade of life. I co-authored this with my CFO, Liz Levy. And together we created this manual that's going to help you through every stage of life. We talk about having a baby. We talk about young adulthood, pre-retirement, what to do when you're at that age of retirement. If you're contemplating divorce, do you need an estate plan? We cover all of these, each subject in a different chapter. And I really think that you're going to find this so helpful, because at the end of every chapter, we have checklists that you can look at and you can use, and they can be a guide for you. So this is a wonderful manual that we've created. It's available on Amazon. You can also find it on our website at judithheft.com/book. And we're here for you. If you need anything, reach out. I hope you enjoy the book. Here's another picture of it, just so you know what's going on. Here it is. And I'm really proud of it. It's my second book, and I'd love to have you read it and give me your feedback. Judy Heft, judithheft.com, financial and lifestyle concierge, celebrating 26 years in business. And over the years, I've learned so much. And what I've been trying to do is impart a little bit of this knowledge to you, so I can help all of you become as financially organized as I am.
And we're back here. We're back with Maura Carley of Healthcare Navigation. So Maura, let's talk a little bit about COBRA and how that all works.
Well, let me just say before we dive into that, we're seeing people who misunderstand COBRA altogether, thinking it's like another program they're entitled to. And, let's just be clear. COBRA is the temporary extension of group coverage. So you're not eligible for it if you weren't employed or your spouse was employed and you got coverage through one of those jobs. So it started in the 80s, and at that point, individual coverage was largely medically underwritten. So you had the phenomenon you were just talking about with the people not getting divorced, people hanging on to various jobs or life situations to maintain their coverage. And COBRA was intended to be a safety net for the worker and anybody else on the worker's plan. So typically, there's always an exception, notably New York, but typically under federal COBRA, which is an employer of 20 or more, the worker is eligible for COBRA for up to 18 months, and someone getting divorced or a widow or someone now with Obamacare aging off a plan at 26 is eligible for up to 36 months. And you're an appendage to the group. You know, if the company goes out of business, there's no COBRA. You're an appendage to the group at your own expense. So COBRA can be very expensive. You know, there's a reason for the term COBRA shock, but almost everything is expensive now unless it's subsidized by someone.
So you mean, so the person that doesn't have the coverage, that say that it's a divorce situation, and we'll just make up things. So, and the woman was the one that didn't work. It was the husband's coverage. So after the divorce, does she have to pay those premiums, and are they usually higher than what they were paying before? How does that all work?
Well, they are usually much higher because the
Right.
employer is subsidizing the group coverage as a rule. And so you're paying 100%, and then there can be a small service charge on top of that. I mean, there are times now, I think many people in the HR world have gotten far away from what the original purpose of COBRA was, and, you know, offer it as sort of a part of an exit package. And we see that can be great for some people, but if you're Medicare eligible, you know, COBRA wasn't designed for you. You're supposed to be on Medicare. So what really worries me is the people who take the COBRA, even though it's expensive. We have a certain profile of client who does this. You know, they think they can take the COBRA, stay on it for 18 months. They take it because Medicare seems so overwhelming. You know, ABCD supplements.
Yeah,
It
it
is.
is overwhelming.
And they've only had, you know, an HR department that offered them their whole lives, like 3 choices.
Right.
And so they say, oh, I'm kicking this decision down the road. They take COBRA, they miss the very strict Medicare enrollment periods. And you know what? We've seen, and it's very punitive. You pay premium penalties for life in those situations for Part B. It's really designed to be punitive. I'm sure it was designed that way to get people to sign up for Part B and not say, you know, Medicare Part B, I'll wait until I'm sick. Okay, Medicare started in 66, so that's probably 1966, why it was set up to be so punitive. But then COBRA's, why that hasn't been fixed so that, you know, you're not penalized if you stay on COBRA. You should only be penalized theoretically, in my opinion, if you weren't paying into the system when you should have.
I had that situation with a client who didn't go on to Medicare when she should have or could have, or when she was eligible, because she was on her husband's policy. And so she didn't bother. So then after their situation changed and she wanted to go on it, she was penalized. Her premiums were really high, especially on her Part D. That's a prescription one, correct? She was really penalized on that a lot. She had to pay very high premiums for not taking anything like that. Is that normal? Does that still happen? This was quite a few years ago.
Oh yes, it's a very unforgiving system. I mean, the only good news, and good news can be, you know, you can wait a long time for some good news, but it used to be, so those people who've messed up their enrollment for Medicare Part B, actually the cost of Medicare Part B premiums can be even more than D. But the way they get on to Medicare Part B is during the first quarter of the year. Every year there's a general enrollment period. You know, that's not the way you want to get onto Medicare Part B. And forever, your Medicare Part B effective date wasn't until July 1, which is horrible. Why would we want people to not be covered? And recently that changed so that if you apply in January during the general enrollment period, your Part B is effective February 1. So you still have a gap, which I hate any gap in coverage, but it's not a 6-month gap. So, and the way it works is, let's say we see people working into their mid-70s, late 70s, and they've not manage their transition to Medicare well and end up having to use the general enrollment period. The penalties aren't just for, okay, so Medicare gives you 8 months and you stayed on COBRA for 18. According to the government, there's 10 months there that you should have been paying for Medicare Part B. So maybe I owe you, government, 10 months worth of something, right? But oh no, you pay a penalty that's a percentage of the Medicare premium for every year going back to your 66th birthday, which is when you could have been on Medicare. It starts penalizing you after 12 months of when you could have been on Medicare. So it's very, very punitive. And we, I don't want to sound like I'm picking on HR people, but the problem is it's their job to know the group coverage, not understand Medicare. And often retirees are not getting the best advice.
Yes, I do remember now with that client. It did go back all those years that she should have gotten on it, and she was already in her 80s. So it was a huge penalty that she had to pay too, on top of everything else. Yeah, it's an interesting concept. It's confusing, I think, to most people. So it's great. So this was really interesting. I think we learned a lot today about Medicare open enrollments and COBRA, everything like that. And I know that you have a lot more to talk about. So we'll have to have you come back another time. But Maura, thank you so much for being a great guest today. I really enjoyed it. How can our listeners find you?
Well, our website is healthcarenavigation.com. And our 800 number, which I should know by heart, is all over that. But our local number is 203-655-2614. And you can always send an email at info@healthcarenavigation.com. And we monitor voicemails and we look at emails every couple of hours. So we get back to everybody.
That's great. I'm sure they can find you on LinkedIn too. They're looking for you.
And we publish weekly videos ourselves. So if you look at healthcarenavigation.com, you can see we have a library of educational videos on YouTube, and they are also on our website.
Oh, that's great. That's great information. I hope that our listeners will use that as a resource. So thank you so much for being a great guest today, Maura. I appreciate it.
Okay, thanks for having me.
My pleasure.
Thank you for tuning into Mastering Your Financial Life, hosted by Judy Heft. You can read chapters of her books and catch prior episodes of the show at www.judithheft.com. Thank you for your positive comments and sharing this show with others.